Okay, so in hospital setting, you know that sudden cardiac arrest, isn't it? Near neighbors, in near home, they said no. Somebody say no, their patient, somebody's death due to some cardiac accidents or cardiac death. You heard the term? Okay, so what is meant by that? The heart is unable to pump the blood. Okay, so it all over the body. When the heart is stopped to pump, we used to say as a cardiac death. Okay, so in a emergency situation, even the cardiac arrest, the heart is unable to pump the blood also. Within 1 hour, if we are giving the CPR, here recently the term is called as compression only life support, COLS, that you just noted, COLS, compression only life support. So previously we used to say the term as cardiac pulmonary resuscitation, CPR. Okay, so in this method calls even the lay person, anybody without medical persons, your uncle, auntie or your home, anybody can give this method in case any cardiac emergencies happen. Okay, so for that, what we supposed to do means, all the patients we not supposed to give this compression. Okay, so before that, we just confirm that whether the patient is heart is functioning or not. How we know our heart is functioning or not? We have some pulses in our body, peripheral pulses and major pulse. We used to check in a particular area. Actually, where we used to check the pulse in the peripheral pulse means total pulse.
Pulse na in the area, this area. Yes. This is a very easy. You can feel this pulse very easily. But a cardiac arrest was only sometimes you may not feel this pulse. Last time we feel the pulse was the carotid pulse of the tube. Same way you touch here and see. Two sides we touch pulse. So in the pulse we last time.
Either you have to check the carotid pulse of the tube. So yeah, this both pulse is not clear. Okay, then you just confirm in your mind the patients they need the cardiac compression. So immediately you have to call the person. For that, first in case any emergency situation you are handling like this. So first you call the persons. In the normal patients don't give this compression. Okay, so first you ask the patient response. How to get the patient response? You just call the person. Sometimes if you know the name, you call by the name. Otherwise, hello Mr. Hello, are you hearing? Like that you can ask. If the patient is response means, immediately you can shift the victim to the hospital. No need to give the compression. But after that, second step, immediately you use the face or high near the patient's nose. Whether the patient is taking breathing or not. That method also you have to follow. Then you have to check for the carotid pulse. Okay, so the pulse also is not feel. Then immediately near some health persons there means by the same way everything supposed to happen within the minutes. Okay, so you just near one person is there means ask them to call the hospital some ambulance name. You know that 108 numbers. Okay, so for saving the time, you just inform the persons to call the emergency number. In the same meanwhile, you have to place the patient in the comfortable position. Before giving these calls, once again you remember that whether the patient's rib means when you get fractured or not, it's normal. Once if the ribs are fractured means you don't do this compression. Okay, so if the ribs are okay, how to give the compression means it's very easy. You know all of them. This is the CP sternum. Yes, where you just feel the CP sternum. Yes, okay, this is the CP sternum. In this CP sternum, you have to place your 2 fingers here. Above the 2 fingers, our place to give the pulse compression. Clear? Okay, so we just imagine that place the CP sternum, place your 2 fingers above that point of giving the compression. Here, you have to place your hands heels. Okay, so first you have to keep your non-dominant hand heel first in the particular point. See here, yes, this place. Here you keep your non-dominant hands heel. Then our dominant hands is supposed to lock the non-dominant hand. Clear, everyone? Yes. Okay, so like that. While starting this compression, our body is supposed to be straight. Don't burn like this, Okay, so our both hands supposed to be straight. Then only we can be able to give the strong compression. Okay, while giving this compression itself, our heart to start function. Clear? Like that effort, we have to do the compression. So, shall I do? Here is a CP sternum. 2 fingers above. Place your non-dominant hands heels like this. Then you have to lock the non-dominant hands with your dominant hands like this. You start the compression. In 1 minute you have to give 100 compression. 100 to 120. Clear? You may have some stamina to give. Okay, so above 100 to 120. Above 110 or below 110. Not below. 100 to 110. Okay. Shall we start? You just count it. Ready? 1, 2, 3, start. 1, 2, 3, 4, 1, 2, 5, 6, 7, 8, Yes, reach above 100, isn't it? Once if you above 100, 110, after that you just check the response of the patient. Hello, Mr. Hello. Otherwise you speak with the check the carotid pulse. Once if not response means again you start to do the compression. Like that till the patient get response, you have to give the compression. Okay, so after giving compression you may feel a little tired, isn't it? Then once if continuously 4 cycle, 5 cycle, if you are giving with strong enough like that means immediately the patient heart will refunction. We may feel this carotid pulse. In same by you are giving CPR now, by meanwhile 108 will come. So immediately you can shift the patient to the hospital. Clear? Have any doubt? Compression complete. Your heel is supposed to not move. That is very
same way elbow. You should not bend your elbow. Elbow must be straight.
Remove your shoes.
Hello,
The face and here just hello, mister.
Hello, mister.
Then see whether the patient is breathing or not. Then you check for the pulse. It's not fever. Yes. Then immediately you start the compression.
Elbow is not straight. Elbow straighter. Then you should not bend the elbow.
See.
This is the elbow. Okay, this area is the elbow. You should not bend the elbow. Position straight.
Straight position.
Then only you get the energy to
should be otherwise you may place the now it's elbow right and that elbow should be slight 100 to 120. Okay, count it. See the time and the compression. Elbow. after downloading, here one is there, battery is there, Bluetooth also. If you are on the Bluetooth, after if you are giving the compression, the mobile will display how upward you are giving the compression is correct or wrong. You may go for deep or little superficial, like that. All the feedback the app will. Based on that,
and we are giving it correctly. You want to score around 90 above 90. The score you have to reach above 90 if you are doing it correctly. Like if your elbow is not straight, if you are not giving the proper compression, then it will give you less score. Above 90 score if you receive, then it will confirm that you are doing the procedure the correct way.
place it above that. Remove your watch. Your place. Don't move the hands, okay? Elbow should be straight. Hands.
Keep the elbow straight. Don't stretch the elbow. First batch
Mood.
No, her hands very important. Huh? No, you don't look like that.
Next,